Hi, I'm Christine, and I live in Brighton and Hove, and I'm bipolar. I was diagnosed not until I was in my 40s, and I guess I'm here today because I kind of wanted to talk about the importance of having LGBTQ specific services for people with mental health issues. I feel that people with mental health face a lot of issues, face a lot of discrimination. But I find that when you're gay and you have mental health issues, it's like a double attack sometimes. You know, people can be really off with you because you're gay, and then they're even more off with you because you've got a mental health issue. And the thing you need most when you've got a mental health issue is support and compassion and understanding from people. So I'm going to talk more about my own personal story. You know, I met someone, I fell in love, and I had a wife for 18 years, and about 11 years into our marriage and our relationship, she was diagnosed with cancer, and her name is Chrissy, and Chrissy was my rock. And Chrissy was she kept me quite stable. So while we were married, it was very rare that I had any kind of an episode. There's something about our relationship that kept me quite stable. And when she was diagnosed with cancer and we were told that she was going to die within weeks, I had a very, very bad episode. I did kind of manage to keep it together for about a year to help support her. But then I did really have an incredibly bad episode, and that in the form of a mania, and that I fixated on an idea that if I was dead or if I was away from her, that she would live. So I left and I tried to commit suicide. And I happened to mention it to a friend who said that maybe I should tell my GP that this is where my mind was. So I spoke to my GP about it, and my GP was very dismissive of what was going on in my life at that moment. Wouldn't recognize that I was in a married relationship. Marriage wasn't yet legal in this country. When we moved to Brighton, not long after this, a friend of ours down here, who I confided in that, again, I'd been trying to kill myself, said that maybe you should talk to these people at this charity called Mind Out, just to see if maybe they can help. And my life completely changed. I was given an advocate, and his name was Jason, and he came to a doctor's appointment with me, and immediately the doctor completely changed and suddenly wanted to help me and suddenly listened to me and sent me for an evaluation. And this is how my bipolar diagnosis came out. Through the charity, not only the advocacy service, but I was put in you know, I wanted to be in, but I was able to join their Out of the Blue group, which is for people with mental health issues and suicidal distress. And that just taught me loads and loads of ways of coping, so that for the next year and a half, I was able to support my wife and be there for her as we went through that trauma. Unfortunately, I lost my wife. But I continue to use the LGBTQ mental health services that we have in Brighton and Hove, that is Mind Out, and seek out other services like that for continued support. I don't know, I just really want people to know that, you know, I feel very blessed to live in the city that I do, because it offers that. But I think more cities need to get involved in this kind of thing. You know, they say 1 in 4 people suffer a mental health issue at some point in their life. And I know the statistics for gay people are even higher. And I know the statistics for gay people attempting suicide are way higher than heterosexual people. So, you know, if you are gay and you're suffering with a mental health issue, you know, that things tend to be a lot darker, and we need more support. Because of the prejudice that we suffer already and the isolation. I hope this helps people.